So moving through our components of fitness, we're going to focus on flexibility. So flexibility is defined as the measure of maximum range of movement possible around a joint or joints. So if we look at our elbows, if I extend my bicep and have flexion through my tricep, then I'm at a fully lengthened position, meaning that my joint is at the furthest range of movement that it can go. Now, in terms of flexibility, my flexibility and range of movement is going to allow me to contract my bicep and bring my elbow and bring my forearm closer to my shoulder. Now, there are some people that don't have the flexibility within the joints and the muscles to allow that extreme lengthened position where their arms are straight. They might have an L shape or even further than that. So allowing our muscles to get supple and our joints to become flexible can increase that range of movement, allowing those muscles to work through that lengthened stage to its shortened stage to recruit and develop those muscle fibers. Things that we can think about in terms of flexibility is age-related awareness of our flexibility. The older we get, the least flexible we're going to become. Our joints are going to become stiff, synovial fluid is going to be recruited less, it's not going to come up and increase as age goes on. So when we think about that, we want to be able to put exercise interventions in for older people. So if we're getting older, they still need to be active, creating that need for our body to create and increase synovial fluid and for our muscles to work. If we stop doing exercise and we limit that, then our body doesn't need it, so it's not going to form that relationship to develop as we get older. Forms of exercise that we can do to increase our flexibility within that range of movement at our joints is forms of stretching. So the types of stretchings that we focus on is static stretching, whether it's active or passive. So what that means is if I'm going to do any exercise in terms of stretching, I would lengthen and go from fully lengthened position of that joint and that muscle to its most relaxed stage. So you're almost putting it through that passive part of range of movement, so it's getting that stretch and then getting that shortening of the muscle. The next one is dynamic stretching, which is very similar, although we're just moving, and we can demonstrate that through our gym videos. Our next stretching type is ballistic. So ballistic stretching and PNF stretching are forms of exercise that put our body through and over the range of movement that you're possibly able to do. This can be quite taxing on our muscles, because what you're doing is you're stretching that muscle from where it's able to do it to then pushing it even further. So you're tearing muscle fibers as we do it, creating that resistance in pushing it through that higher level of range of movement. When we want to do these stretches, can be solely on what your goal is as a client. So what we try and aim for is static stretching to be at the end of workouts, because we want to use dynamic stretching to warm our bodies up after a warm-up or before a warm-up, depending on what our goal is with our client. We think about stretching to be the preparation to form exercise, increasing mobility and activation of muscles before we go into repetitions of exercise within the gym or in an outdoor setting. So looking into flexibility and the factors that affect it. Flexibility is allowed through the range of movement within our joints. And our joints are our tendons and our ligaments. Now, our tendons and ligaments join up to the bone and the muscle, that is our muscular structure, our skeletal structure. So if we think about what things can affect it, we can have micro tears within the connective tissue, can cause hindrances in the range of movement. We can have muscular tears and impingement within the range of movement within our muscles to prevent the fully range of movement of that part of your body. That can be a hindrance and a factor that affects our flexibility in that way. Other tissue, like our fat deposits, adipose tissue. Sometimes the range of movement is hindered because we have too much fat built up within a certain area, to prevent that range of movement. Other issues can come from our gender, our age. The human beings that we are, we're all different. We're going to have different ranges of movements within our hips, in our abs, in our arms, in our legs, because when we get older, those connective tissues gets overused, and depending on what we've done in our life and how we've lived, it can cause a lot of later in life factors that will hurt or hinder the flexibility and the range of movements that's allowed arranged around that joint. Another factor that can affect and hinder our flexibility is the temperature. So if we get cold and it's cold weather outside, then our joints can become quite brittle and quite stiff. The ligaments and connective tissue become quite stiff, preventing you from stretching to that further state. If you do end up stretching and you go past the range of movement in the cold weather, you can actually be at a risk of causing micro tears within that connective tissue. If you tear your connective tissue too much, it becomes deposits in terms of scar tissue on scar tissue, which can then become a hindrance to that flexibility. If we look at the guidelines to training flexibility within our FIT principles, the ACSM guidelines suggest that our frequency is between 2 to 3 times a week. So if we're training Monday, Wednesday and a Friday, it allows enough rest time to allow our muscles to get that adaptation within the episodes of training. Intensity, we want to be working between 3 to 4 reps per muscle group, allowing full ranges of movement at any one time. Now, if we look at the types of flexibility training that we're going to use, P&F training in terms of stretching is one of those training sessions that we want to do with a partner, but we only want to do that maybe twice a week, as it's going to have a higher effect on our body systems in terms of the adaptations and pressure and consequences that you could perform for your athlete or your client. Another guideline through time is for static stretching, we want to hold it between 15 and 60 seconds, depending on how many joints are within that stretch. A 6-minute contraction followed by a 10 to 30 second assisted stretch for P&F stretching is probably what we would want to do for that technique. If we look at type within our FIT principle, static, dynamic, P&F and ballistic stretches are all the different types of stretchings that we can use to increase the flexibility. Benefits of flexibility training can come anywhere from stress management, improved posture, improved sports performance. Our performance can increase because if we increase the range of movement around a joint, we can allow that muscle to come from the most lengthened position to shortened movement to almost become a more powerful contraction to move a weight or stretch to run at a faster rate. So relating flexibility training to different people and special populations, we look at disability people. Now, disability people are going to have issues with their range of movement. They're going to have issues in terms of, depending on what their disability is. The exercise options may be limited due to lower limb, range of movement within things, what they physically can do. If their disability is mental or an educational disability, what they can physically and cognitively understand in terms of what you give them. What we would do is consider exercises that are carefully and seek professional advice from someone to suggest what the best course of action is for that person, because you are not qualified to understand their disability as much as what a regular practitioner in terms of a GP or a doctor would be for them. Another area in terms of special populations that we consider is children. So the children that we look at, we need to be careful in terms of stretching. We don't want to over stretch them, because with a young person, their range of movement is going to be a lot longer and higher than the average person, because they're growing their limbs and they're in an unfit place where they're still growing and developing. So you need to be careful about stretching too far and causing soft tissue joint injuries. Another area in terms of special populations would be pregnant women. Now, pregnant women have an increased ability to achieve a greater range of movement because of the relaxin hormone that is secreted when they're pregnant. Now, relaxin goes to all the joints within their working body, and sometimes if you overstretch that person and do maybe yoga and get into positions where you probably weren't able to when you were not pregnant, can cause a lot of damage if they overstretch that connective tissue and cause microfiber tears, because then you're building up those scar tissues around that area. So when you become and have your baby and you come to a normal state of homeostasis, you've still got those scar tissues and war wounds of that overflexible joints because of the relaxin hormone. What I would do for a pregnant woman would be to do short stretches, think about the assistance of what you can do, maybe yoga, but doing beginner's yoga in terms of the movements you want to do, not going overly strained or too much body weight or added weight for them to go into those stretches. When we think about another special population for flexibility training, we consider the aging population. So the older we get, we know our bodies start to decrease, our metabolic rate starts to decrease because the muscle mass reduces. Now, along with that reduction of muscle mass, those aging populations have an increased muscle stiffness. So those muscles, the muscle fibers within get a lot stiffer. There's a lot less fluid and solution and synovial fluid within those joints. So there's going to be a lot less flexibility within them. We don't want to be aggravating them doing too much stretching or too harsh a stretching without warming them up and getting that synovial fluid within those muscles and joints. With the aging population as well, because they are losing that muscle mass and becoming a lower metabolic rate, the thermogenesis side of their bodies is reducing as well. So they have a lot of heat loss, so we need to be careful about what they're going to do in terms of stretching when they're cold.